Did medieval queens truly rule kingdoms? And men broken bodies? Could the same hands that held scepters also concoct healing potions? In a world where illness was a constant shadow, did these powerful women possess secret knowledge of herbs and remedies, defying the medical norms of 1,000 years ago? Number 9. Philippa of Hainault. Philippa of Hainault, queen consort of King Edward III of England, was more than just a royal figurehead. Born around 1314 in Valenciennes, Hainault, Philippa was known for her kindness, intelligence, and a remarkable compassion that extended far beyond the traditional duties of a queen. In an age often characterized by harshness and indifference to suffering, Philippa stood out as a beacon of practical charity and a deep interest in the well-being of her people, particularly those within her own household and the communities she governed. The 14th century was a period of immense medical challenge. The Black Death, though it arrived later in Philippa's reign, loomed as a constant threat. And even before its devastating sweep, common ailments such as fevers, dysentery, smallpox, and various infections claimed lives with terrifying regularity. Sanitation was rudimentary. Understanding of disease transmission was practically non-existent, and medical practitioners, while some were learned, often relied on ancient texts, superstition, and crude methods like bloodletting. For the vast majority of the population, access to skilled physicians was limited, and home remedies, passed down through generations, formed the bedrock of everyday healthcare. It was within this context that Philippa's approach to health and healing gained significance. While she did not hold a formal medical training, which was almost exclusively male and ecclesiastical at the time, historical accounts and contemporary chronicles hinted her deep practical knowledge of herbal remedies. The Queen's household was a bustling hub, housing not only her large family, but also a retinue of courtiers, servants, and attendants. Illness within this close-knit community was a frequent occurrence, and it was often the lady of the house, particularly one with a compassionate nature, who took on the role of primary caregiver. Philippa's gardens at her various residences, such as Windsor Castle and Woodstock, were not merely for aesthetic pleasure. Records from the royal accounts, meticulously kept, sometimes allude to the cultivation of specific plants known for their medicinal properties. These included common herbs like mint for digestion, chamomile for calming, calendula for skin ailments, and potent plants like foxglove used cautiously for heart conditions, though its toxic properties were less understood. It is plausible that Philippa, like many noble women of her era, supervised or even personally participated in the harvesting and preparation of these herbs. Her knowledge would have encompassed the appropriate times for gathering, the methods of drying and storage, and the creation of poultices, tinctures, and infusions. Chroniclers like Jean Froissart, who was a protege of Philippa and spent time in her court, often emphasized her gentle nature and her attention to the needs of others. While Froissart did not explicitly state, Queen Philippa was a healer, his descriptions of her benevolence and her actions during times of distress strongly imply upon her engagements. For instance, during the siege of Calais in 1346, when King Edward III threatened to execute 6 burghers of the town, it was Philippa who famously interceded, kneeling before her husband and pleading for their lives. This act, driven by profound empathy, reflects a person deeply attuned to human suffering and committed to alleviating it. This same empathy would naturally extend to the sick. Within her court, it is recorded that Philippa maintained a well-stocked apothecary, a chamber or cabinet where medicines and herbs were kept. This was common for royal households, but the degree of a queen's personal involvement varied. For Philippa, it appears her interest went beyond mere supervision. There are subtle mentions in court records of her overseeing the preparation of various remedies for common ailments afflicting her children and attendants. For instance, when one of her many children suffered from a fever or a persistent cough, it was often the queen herself, or a trusted lady-in-waiting under her direct instruction, who would administer a remedy made from the court's herbal stores. One particular example, though not a specific cure, illustrates her practical approach to welfare. Philippa took a deep interest in the welfare of the miners, in her husband's newly acquired coal mines in the north of England, particularly at the bishopric of Durham. She reportedly visited these sites, which was unusual for a queen, and was concerned by the harsh conditions and the frequent respiratory ailments that plagued the workers due to coal dust. While she couldn't eradicate the dust, her initiatives included providing better sustenance and significantly supporting the establishment of infirmaries, or places of care where remedies likely herbal in nature would have been made available to the ailing miners. This proactive approach to public health, even on a small scale, was remarkable for its time and points to a queen who understood the direct link between environment and illness. Her patronage of Merton College, Oxford, and her support for scholars, including those studying natural philosophy and medicine, also suggests an intellectual curiosity about the workings of the body and mind. While this was not direct healing, it fostered an environment where medical knowledge could be explored and disseminated, indirectly benefiting her realm. Philippa's role as a mother to 12 children also placed her in a position where practical medical knowledge was indispensable. Infant and child mortality rates were staggeringly high in the Middle Ages. A queen, despite having physicians at her disposal, would have been intimately involved in the daily care of her offspring, dealing with everything from childhood diseases to minor injuries. Her understanding of hygiene, basic first aid, and common herbal remedies for issues like colic, teething pain, or childhood fevers would have been paramount. Historical accounts describe her as a loving and attentive mother, which further supports the idea of her hands-on approach to family health. Perception of Philippa's healing abilities among her contemporaries was likely rooted in her general reputation for kindness and practical wisdom. She was seen as a queen who cared not just about political alliances or royal grandeur, but about the genuine welfare of her people. When chroniclers wrote of her gentle nature and her goodness, this often encompassed acts of succor and practical assistance to the sick and suffering. Her influence was not about miraculous cures, but about diligent care, the application of sensible remedies, known at the time, and the compassion that made a real difference in an era of limited medical intervention. Philippa of Hainault embodied the queen as a caregiver, utilizing the knowledge and resources available to her to soothe suffering and provide comfort in an often unforgiving medieval world. Number 8. Isabella of France. Isabella of France, Queen Consort of King Edward II of England, a figure often remembered for her dramatic political actions, including her role in the deposition of her husband, possessed a practical intelligence that extended beyond the realm of power. Born around 1295 in Paris, Isabella was the daughter of Philip IV of France, a monarch known for his keen intellect and administrative reforms. This upbringing in one of Europe's most sophisticated courts likely instilled in Isabella a pragmatic approach to life and a capacity for strategic thinking, which she applied not only to governance, but also as subtle historic hints to the practical well-being of her household. The early 14th century, much like Philippa's later era, was fraught with medical challenges. Public health was a nebulous concept, and the causes of most diseases remained a mystery. Physicians, while trained, often adhered to the Galenic system of humors, believing that illness resulted from an imbalance of the 4 bodily fluids. Treatments often involved purgatives, emetics, and bloodletting. For common people, and even for the less severe ailments within the royal court, reliance on empirically gathered herbal knowledge was paramount. It was a time when the practical skills of a noblewoman steeped in traditional remedies could be as vital as if not more effective than formal medical practice. Isabella's court, like any medieval royal household, was a microcosm of society, and outbreaks of illness were common. As the lady of the court, The queen was expected to oversee the general welfare of her retinue, which included ensuring their health. While Isabella employed royal physicians and surgeons, her active and decisive personality suggests a queen who would not have passively delegated all matters of health. Instead, she would have taken a direct interest, leveraging her privileged access to resources and knowledge. One area where Isabella's practical application of knowledge likely shone was in the management of her personal health and that of her children. Childbirth was an incredibly dangerous ordeal for women in the Middle Ages, and Isabella gave birth to 4 children who survived to adulthood, a testament not only to fortune but also to the quality of care she received, and likely herself administered. Records indicate her meticulous attention to matters concerning the royal nursery. For example, chronicles sometimes mention her direct involvement in supervising the diet and general regimen of her young children, recognizing the importance of nutrition and hygiene in preventing common childhood ailments, while not explicitly healing. These preventative measures were a crucial part of medieval health management. Her strong connection to her homeland, France, and her family also points to a rich cultural exchange of knowledge, including medical wisdom. The French court was highly refined, and noblewomen were often educated in the arts of household management, which inherently included basic healing and herbalism. Isabella would have brought this knowledge cultivated since her youth to England. Plausible that she maintained correspondence with her family and connections in France, potentially exchanging remedies or information about effective treatments for various conditions. While concrete evidence of Isabella directly healing is scarce, her personal accounts and the surviving administrative documents of her household reveal an organized and efficient queen who managed her finances. This precision would naturally extend to the care of her staff and family. Her financial records show regular purchases of various spices, not just for culinary purposes, but also for medicinal use. Spices like ginger, cinnamon, and cloves were highly valued in medieval medicine for their perceived warming properties, their ability to aid digestion, and their use in antidotes and concoctions. The purchase of these items in significant quantities for her personal stores suggests active oversight of their preparation and application. Moreover, Isabella was known for her intellectual curiosity. She had a personal library, a luxury in that era, and it is known that she possessed texts on various subjects. While specific medical treatises are not prominently listed, it was common for household books of the period to include sections on herbal remedies, household cures, and practical advice for common ailments. It is not a stretch to believe that a queen of her intellect would have studied these texts, a QB practically applied. Chroniclers, while often critical of Isabella's political maneuvering, rarely faulted her personal attentiveness to her household. The role of a queen in the medieval period was multifaceted. She was not only a political figure, but also the chief domestic manager of the vast royal household. This included ensuring the well-being of hundreds of people. While she would have employed apothecaries and physicians, it was common for the queen to personally intervene in cases of severe illness or injury, providing comfort and often administering remedies that she believed to be effective. Consider, for instance, the continuous challenges of travel in the Middle Ages. Isabella was a queen who traveled extensively both within England and to the continent. These journeys were arduous, exposing travelers to new environments, contaminated water sources, and various infections. Surviving such journeys, especially with a large retinue, required constant vigilance over health. Isabella's ability to maintain her health and that of her retinue during these expeditions suggests a practical understanding of preventative measures and immediate remedies for common travel, sicknesses, dysentery, or minor injuries. The perception of Isabella's medical acumen would not have been that of a trained doctor, but rather that of a highly competent and knowledgeable chatelaine. Her household under her effective management would have been seen as relatively well cared for, In a time when illness could decimate a household, a queen who actively managed health resources and possessed practical knowledge of remedies would have been highly valued by her retainers and admired for her diligence. While history often paints her as a stern political player, it was her practical skills, including an implicit understanding of health and healing, that allowed her to maintain order and well-being in her court. Even amidst the turbulent political climate of her time, her shrewdness extended to every facet of her life, including ensuring the health and stability of her powerful household. Number 7. Eleanor of Provence. Eleanor of Provence, Queen Consort of King Henry III of England, was a queen known for her fierce loyalty to her family, her deep piety, and her significant cultural influence on the English court. Born around 1223 in Aix-en-Provence, Eleanor brought with her the refined customs and traditions of the sophisticated Provençal court, a region renowned for its troubadours, its learning, and its rich botanical heritage. This background, coupled with her role as a devoted mother and a queen responsible for a large household, positioned her to be a practitioner of practical healing arts. The 13th century was a period of burgeoning intellectual life in Europe, with the establishment of universities and the rediscovery of ancient Greek and Arab medical texts. However, this academic knowledge was largely confined to a small elite of male scholars and practitioners. For the everyday person, and indeed for most ailments, within even royal households, the practical application of herbal remedies and nursing care remained the primary form of healthcare. Disease outbreaks were common and hygiene was still poorly understood. Queen's household was a vital center for health management, and Eleanor, with her practical intelligence and deep care for her children, would have been at the forefront of this. Eleanor was a mother to 5 children, including the future King Edward I. The maternal instinct in medieval queens often translated into a hands-on approach to the health of their offspring. Infant mortality rates were shockingly high, and every queen would have been intimately involved in the daily routines of her children, from their diet to their cleanliness. Eleanor's personal accounts and letters reveal a mother deeply concerned with her children's well-being. For instance, when her son, Edward, was gravely ill during his childhood, Eleanor was known to personally oversee his care, ensuring that he received the best available remedies. Provence, Eleanor's homeland, was particularly rich in medicinal plants and had a long tradition of herbalism. The region's warm climate supported a diverse range of flora, and its geographical position facilitated cultural exchange with the Arab world, which had advanced medical knowledge. It is highly probable that Eleanor grew up learning about the medicinal properties of various herbs, from simple digestive aids to more complex remedies for fevers or skin conditions. When she moved to England, she would have brought this knowledge with her, potentially introducing new herbs or methods to the English court's existing repertoire. Historical records mention Eleanor's involvement in managing the royal gardens. While these were primarily for pleasure and food, it was common practice for medieval noblewomen to dedicate sections of their gardens to medicinal plants. These herb gardens, or physic gardens, were essential for preparing household remedies. The queen would have overseen their cultivation, harvesting, and the subsequent preparation of tinctures, poultices, and salves. For instance, common herbs like rosemary for memory and headaches, lavender for calming and antiseptic properties, and sage for sore throats were staples in such gardens and would have been utilized under Eleanor's direction. Eleanor's piety also played a significant role in her approach to healing. As a devout woman, she often visited hospitals and leper colonies, not just as a patron, but sometimes to offer comfort and practical assistance to the sick. While these visits were primarily acts of charity and spiritual devotion, they would have exposed her to the grim realities of disease and suffering, reinforcing her practical knowledge of basic hygiene and the necessity of providing care. Accounts describe her as actively engaging with the sick, listening to their complaints, and often providing not just alms, but also implicitly basic care or directing her attendants to apply certain remedies. The perception of Eleanor as a queen who deeply cared for her household and subjects was widespread. Chroniclers of the time often praised her devotion to her family and her acts of charity. Her attentiveness to the health of her household members, from the highest noble to the lowest servant, would have been part of her expected duties as a queen. Her ability to maintain a relatively healthy court, despite the ever-present threat of disease, speaks to her effective management and her practical knowledge of health. For instance, when outbreaks of dysentery or other common fevers swept through the court, Eleanor would have been instrumental in isolating the sick, overseeing their care, and ensuring that appropriate remedies were applied. She would have worked closely with her physicians and apothecaries, but her personal involvement would have been key. She was known to be a strong-willed woman, and this strength would have translated into decisive action in times of medical crisis. Her strong character and her ability to navigate complex political situations also suggest a practical and resilient mind, traits that are invaluable in dealing with medical challenges. She was not a queen to shy away from difficult realities, and the constant threat of illness was one such reality she would have faced head-on. Eleanor's direct involvement in the details of her household, including the health and welfare of its members, was a hallmark of her reign. Her commitment to maintaining a healthy environment for her family and court, drawing upon the rich herbal traditions of her homeland and the practical wisdom expected of a medieval queen, solidified her reputation as a compassionate and capable ruler. In all aspects of her life, including the quiet essential art of healing. Number 6. Isabella, the First of Castile. Isabella, the First of Castile, often known as Isabella the Catholic, was a monarch of immense power and influence who, alongside her husband, Ferdinand II of Aragon, laid the foundations for modern Spain. Born in 1451 in Madrigal de las Altas Torres, Castile, Isabella was a woman of profound intellect, deep piety, and remarkable administrative skill. While her reign is remembered for the unification of Spain, the Reconquista, and the sponsorship of Columbus's voyages, Isabella's practical leadership extended to all facets of her kingdom, including an acute awareness of and involvement. The late 15th century saw the very beginnings of a more systematic approach to medicine, yet it remained largely based on ancient principles. The plague was still a recurring terror, and common illnesses continued to devastate population. However, the courts of monarchs like Isabella were starting to attract more learned physicians and apothecaries who, while still relying on traditional methods, were also beginning to explore new ideas. Isabella's court was known for its intellectual vibrancy, and she, with her inquiring mind, would have actively engaged with the medical knowledge available to her. Isabella was a mother of 5 children, including the future Queen Joanna of Castile and Catherine of Aragon, Queen of England. Constant threat of childhood illness meant that Isabella, like other queens, was intimately involved in the care of her children. Her personal letters and the chronicles of her court reveal a queen who was deeply attentive to the health of her family. For example, when her son, Prince John, suffered from what appears to have been tuberculosis, Isabella was known to personally oversee his medical care, consulting with multiple physicians and exploring various remedies. While these efforts ultimately failed to save him, they highlight her proactive and deeply concerned approach to the health of her loved ones. Isabella was renowned for her administrative prowess. Her court was meticulously managed, and this attention to detail extended to the royal infirmary and the provision of medical supplies. Records show that she maintained a well-stocked botica, or pharmacy, within her palace, overseen by skilled apothecaries, but almost certainly with her direct oversight. The purchase records indicate a wide array of herbs, spices, and other substances known for their medicinal properties. These included not just local Iberian herbs, but also exotic spices from the burgeoning global trade routes, highlighting her access to and utilization of the most advanced medical resources of her time. Her piety and charitable works were also a significant aspect of her rule, and these often intersected with health. Isabella founded numerous hospitals and infirmaries across her kingdom, not just as institutions but as places of genuine care for the sick and poor. She would often visit these institutions, showing a personal interest in their operations and the welfare of the patients. While she did not personally perform surgery, her presence, her inquiries into their treatments, and her direct instructions to her administrators regarding the provision of food, warmth, and remedies for the sick demonstrate a hands-on approach to public health and welfare. One of the most telling examples of Isabella's practical involvement in healthcare comes from her campaigns during the Reconquista. As a warrior queen, she was often present on the battlefield or in military camps, places where injuries and disease were rampant. Isabella famously established mobile field hospitals during these campaigns, a pioneering concept. For the time, these Queen's Hospitals, or Tiendas de la Reina, provided immediate medical attention to wounded soldiers, irrespective of rank. She ensured that these hospitals were well supplied with bandages, medicines, and food, and that skilled surgeons and healers were available. This was an unprecedented level of royal support for military medicine and boasts her practical, compassionate, and highly effective approach to mitigating suffering. Her interest in medical knowledge extended to the support of medical education and the collection of medical texts. Isabella's court was a center of learning, and she actively encouraged the translation and study of important medical works, including those from Arabic and Jewish scholars who had preserved much of the ancient medical wisdom. While she was not a scholar in medicine herself, her patronage created an environment where medical knowledge could flourish, ultimately benefiting her realm. The perception of Isabella's healing and caregiving extended beyond her immediate court. She was seen as a queen who cared for her people, a monarch who took their physical well-being seriously. Her efforts to improve sanitation in cities, though rudimentary by modern standards, were also part of her practical approach to public health. For example, she issued ordinances in various towns to improve water supply and waste disposal, recognizing the link between cleanliness and disease. Isabella's strong will and meticulous nature meant that she did not just delegate, but actively oversaw her role in ensuring the health of her large court. Her efforts in establishing and maintaining field hospitals during wartime, and her broader support for medical institutions and knowledge, all point to a queen who understood the vital importance of health management. She was not merely a figurehead, she was a hands-on ruler whose pragmatic intelligence extended to ensuring the practical welfare of her kingdom, making her a formidable queen, not just in politics, but in the crucial realm of healing and care. Number 5. Blanche of Castile. Blanche of Castile, Queen of France and later regent for her son Louis IX, was a woman of extraordinary strength, intelligence, and unwavering determination. Born in 1188 in Palencia, Spain, Blanche was the daughter of Alfonso VIII of Castile and Eleanor of England, making her a granddaughter of Eleanor of Aquitaine. Her upbringing in a court that valued education and strong leadership, combined with her deep piety, shaped her into a queen who took a proactive and hands-on approach to governance, including the vital area of public health and welfare. The early 13th century was a challenging time for health. Medical understanding was still largely based on ancient Greek and Roman theories, augmented by some practical experience and superstition. Formal medical training was limited, and the church played a significant role in providing care through monasteries and hospices. For the general populace and even for members of the royal court, herbal remedies and home nursing were the most common forms of intervention for illness and injury. Blanche, as a queen deeply invested in the well-being of her subjects, would have been at the forefront of this practical care. Blanche was a mother to numerous children, 10 of whom were born alive, though many did not survive to adulthood. This experience, common for medieval queens, would have immersed her in the daily realities of child health and the constant threat of disease. Her personal letters and the chronicles of the time portray her as an intensely devoted mother, It is plausible that she personally supervised the preparation of remedies for her ailing children, understanding the nuances of different herbs and their applications for common childhood ailments like fevers, coughs, or digestive issues. She would have worked closely with the royal physicians and apothecaries, but her personal oversight and knowledge would have been critical. Blanche's reputation for piety and charity was legendary. She saw it as her duty to care for the poor and the sick, mirroring the actions of the saints. She admired, she actively supported and expanded existing hospitals and established new ones, understanding that these institutions were critical lifelines for the vulnerable. Her support was not just financial. Chroniclers describe her as frequently visiting these institutions, particularly the Hôtel Dieu in Paris, France's oldest hospital. During these visits, she was known to personally engage with the sick, offering comfort and occasionally administering remedies or overseeing their distribution. This direct involvement went beyond mere patronage. It reflected a practical commitment to alleviating suffering. The royal household itself was a place where Blanche's practical healing skills would have been vital. With hundreds of people living in close proximity, illness could spread rapidly. As the chief manager of the household, Blanche would have been responsible for maintaining a degree of hygiene and ensuring the health of her vast retinue. Her careful management of household provisions would have included a well-stocked herbal larder from which remedies for various common complaints, from colds and coughs to minor injuries and stomach upsets, would have been prepared, while specific instances of Blanche personally concocting a remedy, her general reputation for meticulousness and direct involvement in all aspects of her rule strongly suggest her engagement. She was known for her attention to detail in administrative matters, from finance to diplomatic negotiations. It is logical that this level of detail would extend to ensuring the health of her staff and family. She would have instructed her personal apothecaries and herbalists, drawing on her own knowledge and traditions, passed down through her noble lineage. Blanche's upbringing in a court with strong ties to both English and Castilian medical traditions would have given her a broad perspective on herbal remedies. Spain in particular benefited from Moorish medical knowledge, which was highly advanced for its time. It is conceivable that some of this knowledge, transmitted through her Castilian heritage, influenced her approach to healing and the types of remedies she might have favored or introduced to the French court. The perception of Blanche's healing and caregiving skills by her contemporaries was intertwined with her image as a devout and benevolent ruler. She was not seen as a trained physician, but as a compassionate queen who actively cared for the physical and spiritual well-being of her people. Her commitment to charity and her hands-on approach to managing her household, which included health provisions, would have been widely admired. Her ability to maintain stability and relative health within her court and amongst her subjects, even during turbulent political times, was a testament to her practical wisdom and her dedication to all facets of her queenship, including the vital art of healing. Blanche of Castile embodied the medieval queen as a guardian of both the realm and the health of its people. Number 4. Eleanor of Aquitaine. Eleanor of Aquitaine, one of the most powerful and influential women of the Middle Ages, Queen of France and later Queen of England, was a figure of immense political and cultural importance. Born around 1122 in Poitiers, Duchy of Aquitaine, Eleanor inherited vast territories and a keen intellect. While she is celebrated for her political acumen, patronage of the arts, and her role in the Crusades, Eleanor's practical engagement with the health and welfare of her expansive court and subjects was a less publicized but equally vital aspect of her queenship. The 12th century was a period where formal medicine was still nascent. Monasteries and church institutions were the primary centers of medical knowledge and care, often relying on herbal traditions passed down through generations. Physicians, few and far between, primarily served the very wealthy. For the majority, health care was a matter of home remedies, folk traditions, and the practical knowledge held by noblewomen who managed large households. Eleanor, as the ruler of vast domains and the head of an enormous traveling court, would have commanded significant resources, including medical expertise, but also held deep personal knowledge of healing arts. Eleanor was a prolific mother, giving birth to 10 children who survived to adulthood. Her direct experience with childbirth, infant care, and the myriad of childhood diseases would have provided her with invaluable practical knowledge of health and illness. Historical accounts suggest that she was deeply involved in the upbringing and welfare of her children. Like many noble women, she would have possessed a household book containing recipes not only for cooking but also for herbal remedies, poultices, and balms to treat common ailments among her large family and retinue. Aquitaine, Eleanor's homeland, was known for its diverse climate and rich botanical resources. It was a region with a strong tradition of herbal medicine and practical knowledge of nature. Eleanor, having grown up in this environment, would have been steeped in the local traditions of identifying and utilizing medicinal plants. When she became Queen of France and then Queen of England, she likely brought these traditions and knowledge with her, potentially introducing new methods or ingredients to the court she presided over. Eleanor's patronage of monasteries and religious houses, often centers of medical knowledge and care, also suggests her active interest in healing. While she often granted charters and lent her support often extended to the practical operations of these institutions. For example, some monastic infirmaries which cared for the sick and the poor likely benefited from her specific instructions or the provision of particular herbs from her own gardens. Her legendary intelligence meant she would not have been a passive patron, but would have engaged with the medical practices of these institutions. Perhaps the most significant evidence of Eleanor's practical health management comes from her extensive travels, particularly during the Second Crusade. Leading a large contingent of her own, she was responsible for the well-being of thousands of people under arduous conditions. Illness, injury, and disease were constant threats on such expeditions. Accounts, though sometimes embellished, suggest Eleanor's direct intervention in maintaining the health and morale of her troops and retinue. She would have ensured the provision of clean water where possible, supervised the preparation of food, and overseen the care of the sick and wounded. The logistics of keeping so many people relatively healthy on such a journey point to a sophisticated understanding of practical hygiene and immediate medical response. While no chronicler explicitly described Eleanor concocting a specific herbal remedy, her reputation for being a highly capable and hands-on ruler suggests that she was intimately involved in the practical aspects of managing her vast court. This would have included the appointment of skilled physicians and apothecaries, and crucially her own oversight of the provision of remedies. She was known for her keen observation and her ability to grasp complex situations quickly, traits that would have served her well in assessing ailments and directing appropriate care. Perception of Eleanor's healing skills among her contemporaries would have been less about her being a physician and more about her being a supremely capable and caring queen. Her longevity, surviving into her 80s in an era of high mortality, also points to her personal understanding of health management and perhaps the benefits of the remedies she employed. Her support for hospitals, her experience as a mother, and her practical leadership during challenging expeditions collectively paint a picture of a queen deeply invested in and knowledgeable about the practicalities of health and healing. Eleanor of Aquitaine, the political powerhouse, was also implicitly a highly skilled manager of health and welfare within her powerful realm. Number 3. Saint Elizabeth of Hungary. Saint Elizabeth of Hungary, though a princess by birth and queen consort of Ludwig IV, Landgrave of Thuringia, is perhaps one of the most prominent examples of a medieval royal figure directly and personally involved in healing and caring for the sick. Born in 1207 in Saraspatak, Hungary, Elizabeth was the daughter of King Andrew II of Hungary and Gertrude of Morania. Her life was defined by an extraordinary devotion to Christian charity, which manifested in radical acts of service to the poor and infirm, far exceeding the typical royal patronage. The 13th century was characterized by widespread poverty, frequent famines, and devastating epidemics. Medical care, as previously noted, was basic, relying heavily on traditional remedies and the care provided by religious orders. While physicians existed, their services were costly, and their efficacy often limited. It was in this context of immense suffering that Elizabeth's personal ministry of healing shone, earning her a reputation for sanctity even during her lifetime. Elizabeth was married at a young age and became a mother to 3 children. Despite her royal status, she chose to live a life of extreme asceticism and active service. She famously eschewed luxury and dedicated herself to caring for the poor, the sick, and the lepers. This was not a passive form of charity. Elizabeth would personally attend to them, washing their feet, cleaning their wounds, and feeding them. Chroniclers and witnesses during her canonization process provided numerous testimonies of her direct involvement in these acts of care. Her knowledge of herbal remedies and practical nursing skills was widely attested. She established a hospital at the foot of her castle in Marburg, not merely funding it but personally working within its walls. She would prepare remedies with her own hands, using herbs gathered from her gardens or procured from local herbalists. She was known to understand the properties of various plants and their application to different ailments. For instance, she would apply poultices to sores, administer herbal infusions for fevers, and tend to the festering wounds of lepers, actions that horrified some of her courtiers, but brought immense comfort to the afflicted. One well-documented anecdote highlights her direct healing involvement. During a severe famine in Thuringia, Elizabeth organized extensive relief efforts, distributing food and tending to the starving and sick. She personally cared for those afflicted with scrofula, a form of tuberculosis affecting lymph nodes, and other debilitating conditions. She believed in the healing power of touch and prayer alongside practical remedies. Her dedication was so profound that she often emptied the royal storehouses to provide for the needy, much to the chagrin of her husband's family. Her practical skills extended to basic hygiene and wound care, which were critical in preventing the spread of disease. She understood the importance of cleanliness, a concept not widely appreciated in the medieval period. She would personally wash the clothes and bodies of the sick and meticulously prepare their food. This focus on sanitation, combined with her knowledge of soothing and antiseptic herbs, would have made her a remarkably effective carelore for her time. Elizabeth's gardens were not just for beauty. They were vital sources of medicinal plants. She would oversee the cultivation of herbs like plantain for wound healing, marshmallow for soothing inflammation, comfrey for bone breaks, and many others. She understood the seasonal nature of these plants and the proper methods for their drying and storage to preserve their potency. Her knowledge was empirical, based on observation and traditional wisdom passed down through generations. Perception of Elizabeth's healing abilities was deeply intertwined with her spiritual reputation. Many believed her touch brought miraculous cures, but even beyond the miraculous, her contemporaries recognized and valued her practical medical skills and her profound compassion. She was seen as a living saint whose acts of service, including direct nursing and the application of remedies, demonstrated a tangible commitment to the suffering of humanity. She was often depicted holding a basket of food or herbs, symbolizing her role as a provider and a healer. After her husband's death, Elizabeth renounced her royal titles and possessions, choosing to live in humble circumstances and dedicate her life entirely to serving the poor and sick. In the hostility, this radical decision underscored her commitment to practical healing and service. Her life stands as a testament to a medieval queen who was not just a patron of healing, but a direct, hands-on practitioner of the healing arts, embodying compassion and practical wisdom in a world desperately in need. Her personal dedication to the sick, her establishment of hospitals, and her practical knowledge of herbal remedies make her an undeniable figure in the history of medieval queens as healers. Number 2. Hildegard of Bingen. Hildegard of Bingen, though primarily known as an abbess, mystic, visionary, composer, and philosopher, was also a formidable natural scientist and physician whose writings on medicine and Isabel from the medieval period. Born in 1098 in Bermersheim-Vorderhall, Holy Roman Empire, Hildegard came from a noble family, and her intellectual and spiritual influence extended to the highest echelons of power, including emperors and queens. While not a queen consort in the traditional sense, her immense knowledge and written works on healing significantly influenced royal and noble households across Europe, making her a queen of knowledge in the realm of medieval medicine. 12th century, when Hildegard lived, was a time when medical knowledge was slowly beginning to be compiled and documented. However, it was still deeply intertwined with spiritual beliefs, and many treatments relied on folk traditions and the use of natural substances. Formal medical training was rudimentary, and access to trained doctors was limited. Hildegard's unique contribution was her systematic approach to observing the natural world and categorizing plants, minerals, and animals based on their medicinal properties, a truly scientific approach for her era. Hildegard's two major medical works, Physica and Causae et Curae, detail a vast array of natural remedies and medical theories. Physica, meaning natural history, is a compendium of knowledge on various plants, elements, trees, stones, fish, birds, and animals, describing their medicinal properties. Causae et Curae, or Causes and Cures, delves into the human body, the causes of disease, and the appropriate treatments, including detailed herbal remedies, dietary advice, and even psychological insights. Hildegard's medical philosophy was holistic, emphasizing the interconnectedness of body, mind, and spirit. She believed that illness was often caused by an imbalance in the humors, but also by improper diet, lack of exercise, or spiritual distress. Her remedies, therefore, often combined herbal preparations with specific dietary instructions and recommendations for spiritual well-being. For example, she frequently recommended specific foods for different temperaments and ailments, such as fennel for good digestion or chestnuts for brain health. Her detailed descriptions of herbs are remarkable. She identified and cataloged hundreds of plants describing their appearance, their growing conditions, and their specific medicinal uses. For instance, she wrote extensively about spikenard for heart conditions, collingale for digestive issues, and lavender for nervous complaints. She also detailed how these herbs should be prepared as teas, poultices, tinctures, or powders. Her precision in naming the plants and their applications was exceptional for her time. Although she resided in a monastery, Hildegard's influence reached far beyond its walls. Her writings were widely disseminated, copied by scribes, and studied by scholars and practitioners across Europe. Royal and noble households, including queens, would have had access to her text. It is highly probable that royal physicians and apothecaries consulted her works, and that queens seeking the best possible care for themselves and their families would have drawn upon her vast knowledge. For example, a queen dealing with chronic digestive issues might have found remedies for stomach pain using Hildegard's recommended herbs like peppermint or fennel, prepared according to her instructions. Hildegard's monastery also had an infirmary, where she and her nuns cared for the sick. Here she would have personally applied her theoretical knowledge. While queens typically had their own physicians, Hildegard's practical success in treating illnesses and her detailed written records would have been a prized resource. Her comprehensive understanding of women's health, including remedies for menstrual issues and childbirth complications, would have been particularly valuable to queens and their ladies. The perception of Hildegard's healing acumen was immense. She was revered as a prophetess and a learned woman, and her medical writings were seen as divinely inspired yet practically sound. She was consulted by popes, emperors, and numerous nobles who sought her advice not only on spiritual matters but also on their physical ailments. Her systematic approach to medicine, her keen observation of nature, and her dedication to documenting her findings set her apart as a truly exceptional figure in medieval medical history. While she never held a scepterly, Hildegard of Bingen certainly ruled the minds of those seeking healing in the Middle Ages profoundly, influencing the medical practices in royal courts and beyond through her profound intellectual contribution. Number 1. Empress Theophanu. Empress Theophanu, a Byzantine princess who became Empress of the Holy Roman Empire through her marriage to Emperor Otto II, was a figure of extraordinary intellect, political prowess, and cultural sophistication. Born around 960 in Constantinople, the capital of the Byzantine Empire, Theophanu brought with her the rich scientific and medical traditions of the Eastern Roman Empire, which were far more advanced than those of contemporary Western Europe. Her deep engagement with learning and her practical approach to governance suggest a queen who leveraged this superior knowledge for the health and well-being of her court. The late 10th century in Western Europe was a period of limited medical knowledge, often relying on Germanic folk, remedies, monastic traditions. In stark contrast, the Byzantine Empire maintained a continuous tradition of classical learning, including sophisticated medical science inherited from Greek and Roman antiquity, significantly enhanced by interaction with Arab scholarship. Constantinople was a center of advanced medical education, with hospitals, medical schools, and a vast collection of ancient medical texts. Theophanu, growing up in this environment, would have been exposed to and educated in this advanced medical knowledge. Upon her arrival in the West, Theophanu was not merely a political bride, she was a cultural ambassador, bringing with her Byzantine customs, arts, and, importantly, scientific knowledge. Her personal library was known to be extensive, including Greek manuscripts. It is highly probable that among these were medical treatises. Chroniclers noted her sharp mind and her active role in the intellectual life of her court, which meant she would have engaged with and understood the medical concepts and practices of her Byzantine. As Empress Theophanu bore several children, including the future Emperor Otto III. Like any royal mother, she would have been intimately involved in the health of her offspring. However, her distinct advantage lay in her access to superior Byzantine medical practices. While Western courts relied on local physicians who might be limited in their knowledge, Theophanu could have brought Byzantine physicians, or at least their methods and texts, to her court. Her children's survival rates, particularly Otto III, who reached adulthood in an era of high child mortality, could be attributed not just to fortune, but to the elevated standard of care he received. Theophanu was known for her luxurious and elegant court, which included not just fine silks and jewels, but also sophisticated amenities. This attention to comfort and detail would have extended to hygiene and health. Her court records, though sparse, sometimes allude to specific rare ingredients and preparations not commonly found in the West, possibly referencing Eastern medicines. She likely directed her court apothecaries and herbalists, sharing knowledge of potent Eastern herbs and their applications, or perhaps introducing new, more effective methods of preparing remedies. For instance, Byzantine medicine was adept at using complex compounds and precise measurements, which she might have advocated. Her practical involvement in healing would have manifested not as a hands-on herbalist in the Western sense, but as a knowledgeable director of medical care. She would have instructed her court physicians and servants on specific treatments, drawing from her Byzantine background. For example, Byzantine medicine placed emphasis on preventative measures, diet, and proper sanitation. Theophanu, steeped in this culture, would have ensured her court maintained a higher standard of hygiene and dietary management than was typical in the West, which would have had a direct impact on preventing illness. The the perception of Theophanu by Western chroniclers was often mixed, owing to her foreignness and strong personality. However, her intelligence and competence were undeniable. While Western chroniclers might not have explicitly stated Theophanu healed someone with Byzantine herbs, her elevated medical knowledge would have been evident in the superior health management of her own person and her immediate imperial family. When Emperor Otto II fell ill, Theophanu was reportedly deeply involved in his care, consulting with the most learned individuals and likely applying treatments known from her homeland. The Byzantine Empire was renowned for its advanced hospitals, staffed by trained professionals, and Theophanu would have been familiar with these sophisticated institutions. Her influence on the establishment or improvement of infirmaries within Western monastic communities, or the introduction of more structured care within royal households, would have been a quiet yet significant legacy of her queenship. She brought a level of medical sophistication that was new to the Holy Roman Empire, elevating the standard of care for the imperial family, and by extension influencing the nascent medical practices of Western Europe. Theophanu was not just a queen who patronized healers. She was a queen who embodied and disseminated a superior medical tradition, a true healer, through her intellectual prowess and cultural transfer.